Welcome to the County Press, Rachel Thacker. You're standing, of course, in the Isle of Wight's West constituency, which is new this year, and you're standing for the Alliance for Democracy and Freedom. You've got 45 seconds on these questions. They've been sent in by members of the public. So islanders say overpriced and unreliable ferries have plagued the Isle of Wight for years now. Nick wants to know exactly what you would do, if elected, to improve cross-Solent travel.
It's very easy. I would advocate for the regulation of the ferries to be public function companies, not private companies. That would allow them to have a minimum standard of crossings, a minimum set amount of crossings. Sorry.
Okay.
And the prices would be capped.
Great, okay. And Healthwatch Isle of Wight, going on to dentistry care now. Healthwatch Isle of Wight says that the dental crisis on the island is causing distress to many. Things don't look like they're improving anytime soon. Mike Downs has asked, and he wants to know what you would do about that to tackle that issue. Dentistry
needs to be reintegrated into the NHS, absolutely. We need to find out why the dentists left the NHS in the first place. I know that the GP contracts are forcing GPs to leave and go to other countries. So I would look back in time and find out what happened and why the dentists left us. I would also advocate for dentists to go and visit the schools and do checkups on children, treatment where needed. That used to happen in the past, so I'd bring back that.
And another big issue affecting many islanders is, of course, storm overflows containing sewage discharges into rivers, estuaries, and the seafronts, all on the island, really. Last year, 5,000 hours of sewage was discharged off cows, for example. Michael would like to know how you would hold Southern Water to account as the MP and what you would do to stop the sewage pollution.
I would advocate that the water executives are held criminally liable and that they are regulated again by the government as a public function company. And sorry. I've lost my train of thought. Sorry.
No, that's okay. So going back to Southern Water and what you would do to hold them to account on the sewage discharges and storm overflows.
Yeah, I would make sure that it doesn't happen. The council actually set the rates of how often they can discharge and where they can discharge. So I would argue with the council that they should actually set standards that them at least 2 miles offshore. I know that happens with maritime ships. So I don't see why it shouldn't happen with our land-based discharges either.
Of course, the council would probably argue that they're big private companies and legislation would need to change on a national front to do that.
Which is why I would advocate for them to be public function companies and regulated by the government to allow for that.
Great. And moving on to energy bills, they're about £400 higher than they were 3 years ago, and that's despite the price cap fall, which is going to come into effect in July. What would you do to support islanders in the cost of living crisis?
Again, I think they need to be regulated as public function companies. The costs need to be capped. It's not fair that we're paying so much more money when the resources are in the earth, they're there already, we're using them already. Why is the price continually increasing?
And another big issue affecting islanders and particularly parents is education. What would you do to improve education outcomes on the island and support schools on the island to achieve their goals in the main
I've
long
got
run?
3 children myself. 2 of them are in school, one's a bit young at the moment. So education is important to me. I don't really know why the education system fails on the island. I believe the council say that it's too costly to get qualified teachers here, but that is absolutely what we need. We shouldn't be sending people to look after children and teach children when they're not qualified themselves.
Again, the council probably argue that their hands are tied by government funding. So what would you do on a national level to implement more funding for local council?
The government are responsible for everything, whether it's housing, the cost of living, utilities. They need to be looking at people, not profits, and how people are affected generally.
Great. And St Mary's Hospital, we know that the struggles there with availability of beds. Obviously, you've got the mainland factor as well, and of course, extra pressures that come in the winter months or the summer months. What would you do to alleviate that pressure and improve NHS care in hospitals on the island, in the hospital on the island?
We used to have more hospitals than just St Mary's, I believe. So I would look into why those closed down and is there any chance we can reopen them. I think it's very unfair that we don't have specialists here, such as cancer specialists, and a lot of people have to travel to the mainland for treatment. Heart disease and things like that are another reason, and I think that's very unfair to send sick people over the water. We need our own specialists.
And do you think is that a realistic aim, opening more hospitals? I mean, you know, the Conservatives, for example, would argue that they've just had to secure £50 million for the investment at St Mary's Hospital, and most people would say that was long overdue. Do you think you would be able to secure even more money than that and open more hospitals on the island?
I would argue that the NHS has plenty of money and it's being wasted in the wrong areas. Managers with six-figure salaries, DEI officers with six-figure salaries, do we need those realistically? I mean, it's very simple, treat everybody with respect.
And going on to GP surgeries, again, we've seen, you know, a lot of GP surgeries on the island closing and people struggling to get appointments. What would you do on the more local level of doctor surgeries?
Well, ADF is led by a retired doctor, Dr. Thacker, and he understands the issues that both the doctors themselves face as well as the patients. And he says that it's all down to how they're funded. Basically, the doctors are looking to the government to say, how can we get more money? And the government's going, well, meet this target, meet that target. And it's completely undermining the patient-centred care. So we need to get back to patient-centred care. And going on to crime then, we know that, you know, ASBE's, antisocial behaviour injunctions, stop and search, dispersal orders, bobbies on the beat, and crime levels are the key policing concerns on the island. If you were to work alongside the Police and Crime Commissioner, how would you set and achieve goals in these areas? I would ask to meet with the Police and Crime Commissioner at least monthly to ensure that I'm monitoring the targets that are being set and they're being met. I would also advocate for less money to be wasted on painting vehicles and more frontline officers. And moving on to the quick-fire questions, so these are one-word answers. So yes or no, if you were to be elected, would you like or push for the nationalisation of trains? Yeah. Would you push to rejoin the EU? No. Island or party first? Island. National service, yes or no? Undecided. Okay. Energy, nuclear or alternative? Alternative. And should 16-year-olds be allowed to vote? I don't see why they shouldn't, yeah. We noticed you launched your campaign back in February, I think, and on YouTube, if I'm correct in saying. A couple of bits here and there. I didn't expect the election to come so quickly. Right, okay. So what have you done since that period of electing for your community? I've been going out and knocking door to door and introducing myself to people. I did try and become a school governor at my son's school. When I confronted them on an issue, I got fired shortly after, but not because I confronted them on the issue. I was fired because I didn't actually respond to an email in time, and that's because my children were sick. So I was no longer able to help in that regard. However, the issue I confronted them on was safeguarding talks a lot about female genital mutilation and nothing about non-medically necessary male circumcision. And although I don't agree with either, I think it should be fair across the board. And I think that's all people want, fairness. Okay, and obviously on a community level, have you been, I know you said you've been out knocking on doors, but have you been, you know, campaigning and what have you been doing on on a community level basis? Just literally knocking on doors, handing out leaflets, introducing myself and asking people if they need help with any issues. Okay, and I know the ADF party, a lot of people have raised concerns about some of the party's views. Some are saying that, to be honest, that they're a bit extreme. How would you respond to that? I don't think they're extreme at all. The reason I stand with ADF is because, one, they have the best NHS policy out there, you know, being led by Dr. Thacker, and two, they do not whip their candidates. So it's not about what I want, it's not about what the party want, it's about what islanders want. I'm not a politician. I've never planned to be a politician. I got very angry when I studied law and I realised that my perception was accurate. The system is designed against the individual. Rather than moan about it on Facebook, I thought, do something about it. And realistically,
ADF party currently got no MPs. Realistically, what could you do if you were elected and you were the only ADF party member in Parliament?
It would be a genuine struggle. I would feel like I'm on my own in the House of Commons and fighting an uphill battle, but I would continually fight that battle for the islanders. It's about the people. Parliament should not be sovereign. The people should be sovereign. It's not your choice solo, it's everybody's choice. The majority view should prevail. And that's what ADF is about and what I'm about, bringing democracy back.
Final question, so you get up to a minute on these ones. As an MP, what would your first 3 top priorities be?
The NHS, education and sewage.
And did you want to expand on any of those?
With the NHS, we need to get back to getting GP appointments. So we really need to be able to ring up our GP on a Monday and have an appointment by Wednesday, Friday, not waiting months and months. That is something I feel really passionate about, especially when you're a parent. Your child gets sick, when they're very young especially. You want them seen like that, and that needs to be available. If that means hiring more GPs, then that's what we should do. If the GPs are not there to hire, then we should absolutely, in education, encourage children to grow up to become GPs. So maybe the education department could put on different classes that are after school classes to teach people about health and to encourage them to become dentists and the things we need, basically.
And I'm interested to know what you would do should you be elected and how you would work alongside the other MP for the Isle of Wight, because of course it's being split into 2 constituencies this year. So we know that another ADF candidate isn't standing in the east, and you're obviously in the west. So the obvious option will be that it'd be a different party. Yeah. How would you work with an opposing party?
I have no ego. I will work with anyone that is willing to do right by the islanders and bring democracy back, give the people the power, is a friend by me.
And very, very finally then, what and why, in particular, should islanders trust you to be their MP?
Because my party don't whip me. I've never had a lot of money or a silver spoon in my mouth. I'm literally just an average person. I've got no ulterior motive. I'm here so children can grow up and have homes again, visit the doctor. I'm here for the people.